In this video, we'll explore 12 unusual signs that could indicate damage to your heart. It's crucial to know these signs because you can take steps to prevent the disease from getting worse. The prevalent belief that heart damage is always accompanied by clear and noticeable symptoms is somewhat misguided. In fact, factors like silent inflammation, unnoticed stress, or even poor dental hygiene can contribute to heart damage. Misguided beliefs include the idea that only older adults or those with a poor lifestyle are at risk of heart damage. In fact, conditions like sleep apnea, persistent mental stress, and overlooked dental health, among others, play a significant role, and the list goes on and on. If you want to check for silent or subtle heart issues, stick around and watch this video all the way to the finish. We'll also discuss some simple lifestyle changes and medical interventions to improve your heart health and stop further damage. In our first sign, we're looking at calf swelling or pain, a potentially alarming indicator of peripheral artery disease, often linked to heart damage. This condition emerges when the arteries in your legs become narrowed or blocked, leading to reduced blood flow. It's crucial to recognize this symptom early, as it can signify broader cardiovascular issues, including heart disease. If you notice your calves are swollen or painful, especially after walking or climbing stairs, it's a cue to pay attention. Peripheral artery disease is commonly associated with atherosclerosis, where plaque builds up in the artery. To prevent further complications, lifestyle modifications like regular exercise, a heart-healthy diet, and quitting smoking are recommended, alongside consulting a healthcare professional. Remember, recognizing and addressing these early signs can be pivotal in maintaining your heart health. Moving on to our second sign, erectile dysfunction, often overlooked, can be an early warning of heart disease. This condition isn't just a personal inconvenience. It's a critical health indicator. Erectile dysfunction occurs when there is insufficient blood flow to the penis, which is often caused by underlying issues in the cardiovascular system, such as clogged arteries or heart disease. It's essential to understand that the same processes leading to heart disease can affect the blood vessels anywhere in the body, including those leading to sexual organs. If you're experiencing this issue, it's not only about your sexual health, but potentially your heart health too. Addressing lifestyle factors, seeking medical advice, and managing other heart disease risks are crucial steps in dealing with this symptom. Now let's talk about the third sign, gums bleeding easily, which may seem like a minor issue but can be a soft signal of heart disease. Gum disease or periodontitis is often linked with heart health. The inflammatory response caused by persistent gum disease can lead to swollen and bleeding gums, and this same inflammatory response is believed to increase the risk of heart disease. The bacteria from inflamed gums can enter your bloodstream, potentially affecting your heart's health by contributing to the buildup of plaque in the arteries. Taking care of your oral health isn't just about preventing cavities. It's also about maintaining your heart's health. Regular dental checkups, proper oral hygiene, and addressing any signs of gum disease early are key preventive measures. For our fourth sign, we delve into snoring or sleep apnea, conditions often dismissed as mere nuisances but could indicate more serious heart health issues. Sleep apnea, characterized by pauses in breathing or shallow breaths during sleep, is not just about loud snoring. It's a severe disorder that disrupts your sleep cycle and reduces oxygen flow to your body, putting an enormous strain on your heart. Those with sleep apnea often experience higher blood pressure, irregular heartbeats, and are at a greater risk for heart disease and stroke. If you or your partner notice heavy snoring or gaps in breathing, it's crucial to consult a healthcare professional for a proper diagnosis and treatment, which might include lifestyle changes, CPAP machines, or other interventions. Taking sleep apnea seriously can be a vital step in protecting your heart. Turning to our fifth sign, a sudden onset of extreme weakness, a critical and alarming symptom that could indicate a heart attack. This profound weakness or fatigue isn't just feeling tired. It's an intense, overwhelming sense of exhaustion that can appear without warning. It's your body's way of signaling that your heart might not be pumping effectively, leading to reduced blood flow and oxygen delivery to your muscles and organs. This symptom is particularly concerning when combined with other heart attack signs, such as chest pain or shortness of breath. Immediate medical attention is crucial if you experience such extreme weakness, especially if it's sudden and unexplained, as it could be a life-saving intervention. Moving to sign 6, let's discuss irregular skin rashes or unusual spots, which might be more than just a skin issue. They could be subtle signs of heart disease. Certain types of rashes like psoriasis or eczema are linked to an increased risk of heart problems. These skin conditions are marked by inflammation, a critical factor in the development of atherosclerosis, the hardening of the arteries that can lead to heart attacks. Additionally, some rashes or spots can result from poor circulation, another sign of heart issues. Pay attention to any sudden or chronic changes in your skin's appearance and consult with a healthcare professional to explore the underlying cause and connection to heart health. As we look at sign 7, unexplained nausea or indigestion, it's important to recognize these could be more than just digestive discomforts. They might signal heart disease. Often, people experiencing a heart attack may have symptoms resembling indigestion, nausea, or stomach pain. The discomfort is typically not relieved by antacids or other gastrointestinal treatments. These symptoms occur because during a cardiac event, the heart may struggle to supply oxygen-rich blood to the digestive system, especially if accompanied by other heart attack symptoms such as chest discomfort or shortness of breath. These signs should not be ignored. Seeking immediate medical attention can be crucial in addressing these underlying cardiac issues. Now let's examine sign 8, persistent hoarseness, which might be an unexpected but possible symptom of heart failure. Persistent hoarseness can occur when the heart doesn't pump blood as effectively as it should, leading to fluid buildup in the lungs and affecting the voice box or causing a chronic cough. This symptom is often overlooked but can be associated with the worsening of heart function. If you experience persistent hoarseness without a clear cause such as a cold or allergy, and especially if it's accompanied by other symptoms like shortness of breath or fatigue, it's important to consult with a healthcare professional. Identifying and treating heart issues early can be vital for long-term health and well-being. Moving to sign 9, the loss of consciousness or fainting spells, often referred to as syncope, can be a serious indicator of heart disease. Fainting occurs when the brain temporarily does not receive enough blood supply, and in the context of heart health, this can be due to irregular heartbeats or blockages that impede blood flow. It's a particularly concerning sign if the fainting is sudden and without any preceding symptoms. While fainting can have various causes, recurrent episodes or those associated with chest pain or shortness of breath necessitate immediate medical evaluation to rule out underlying cardiac conditions. Early intervention can be critical in preventing more severe heart-related events. For our 10th sign, let's consider sudden or excessive sweating, which might be an important cardiac warning. Unexpected and profuse sweating, especially when you're not exerting yourself, can be a symptom of a heart attack or other serious heart conditions. It occurs as the body reacts to stress signals from a heart struggling to function properly. This kind of sweating might be accompanied by other symptoms such as chest pain or pressure and shortness of breath. Recognizing this sign as a potential heart issue, rather than attributing it to less serious factors, is crucial. If you experience sudden unexplained sweating, particularly if it's severe or accompanied by other heart symptoms, seeking immediate medical attention can be life-saving. Sign 11 is unusual or prolonged anxiety, which isn't just a mental health concern, but can also be a symptom of heart disease. Anxiety can manifest physically, affecting your heart rate and blood pressure. And in some cases, it might signal an underlying cardiovascular problem, especially if it's sudden, severe, or accompanied by other symptoms like chest pain or shortness of breath. While anxiety has many causes, it's important not to dismiss it, especially if it's a new condition or has significantly intensified. Consulting with healthcare professionals to explore both the psychological and physical facets can be vital in ensuring heart and overall health. Finally, sign 12 is decreased tolerance for exercise, a significant indicator that shouldn't be overlooked as it might denote heart damage. A sudden drop in your ability to engage in physical activity, feeling unusually fatigued during or after exercise, or experiencing symptoms like shortness of breath or chest discomfort could all point to cardiovascular issues. This decrease often occurs because the heart is less efficient at pumping blood and oxygen to the muscles, possibly due to heart disease or blockages in the arteries. If you notice a marked change in your exercise tolerance, it's important to consult with a healthcare provider. Addressing this symptom promptly can be critical in identifying and managing heart conditions effectively. Now that we've understood the signs indicating potential heart damage, Let's pivot towards the crucial steps you can take to improve your heart health and mitigate further damage. It's never too late to start making these changes, and often small steps can lead to big improvements in your cardiovascular health. Firstly, focus on your diet. Reducing intake of saturated fats, trans fats, and cholesterol-rich foods is fundamental. Opt for a diet rich in whole grains, fruits, vegetables, and fatty fish like salmon or mackerel, known for their heart-healthy omega-3 fatty acids. Be mindful of your salt intake to manage blood pressure and limit sugar to avoid excess weight gain and diabetes, both of which strain the heart. Physical activity is equally vital. Engaging in at least 150 minutes of moderate aerobic exercise or 75 minutes of vigorous activity each week. Exercise not only helps in maintaining a healthy weight, but also reduces stress and strengthens your heart muscle. Monitoring and maintaining a healthy blood pressure, cholesterol levels, and diabetes are critical. Regular checkups and following prescribed medications can keep these factors in check, reducing the risk of heart disease significantly. Don't underestimate the power of quitting smoking and limiting alcohol consumption. Both these habits have a profound negative impact on heart health. Quitting can drastically reduce the risk of coronary heart disease, among other benefits. Manage stress through mindfulness, meditation, or yoga. Chronic stress can lead to behavioral factors that increase heart disease risk. Finding healthy ways to cope with stress can improve your heart health and overall well-being.